Hello and welcome to this UniTaster On Demand event today. My name is John Cheek. I'm here from UniTasterDays, and it's my job to introduce the event and introduce our speakers. The subject we're going to be looking at today is healthcare science, but what we're going to be doing is focusing on ophthalmic imaging. And I'm delighted to be joined by Paul and Tracy, who are going to be the experts. They're going to cover four main areas: why you might want to consider the course, what to expect on it, application tips and careers. And with that, I'll pass things over to you, Tracy.
Okay, so thanks, John, for that introduction. As John mentioned, my name is Tracy Longden-Thurgood, and today I'm going to be giving you a presentation on healthcare science with my colleague Paul Dimmock. We're going to sort of tag team the presentation for you. So I'm going to give you a little bit of an introduction today, and then Paul will come in focusing, as John mentioned, particularly around the ophthalmic imaging. So just to give you a little bit of an information about myself. So I am a healthcare scientist by trade. I've been working in the field for 25 years, and I'm currently working as the senior lecturer over at University of Gloucestershire, specifically setting up healthcare courses for those scientists as they enter the field. Ophthalmic imaging is one of those courses, and that's the one that we're going to concentrate a little bit more on today. So in terms of the content of the presentation, I'm going to give you an overview of healthcare science so that you get a feel about what that career might look like if you're interested in that yourself. Then I'm going to talk about different healthcare science topics, study expectations, give you some application tips, and then finally we're going to go through some specific careers that you might do if you were to take on the ophthalmic imaging degree. So just give you some sort of background as to why I decided to enter the field myself all those years ago. It was because I had a huge passion in biology. So I did my A-levels, so it was a very traditional route into the career after my sort of GCSEs, and I loved anything to do with biology and identifying how different diseases came about when you were looking at the human body. Now, with healthcare science, not only do you have all of the biology element into it, what you also have is this technological side. So you're able to look at different parts of the body, find out how they work, and then use different sort of technology to help you analyze that information. And then once you've got that information, if somebody was poorly and they came to you and wanted to know what was wrong and how they might be treated, as a healthcare scientist, you would then be working with that patient as well as colleagues such as doctors and nurses to enable that patient to be treated and cared for in whichever way that data sort of highlighted to you. And so for me, that was an amazing sort of concept. And so I wanted to make sure that I really sort of investigated that and invested my career into that. Now, the beauty about it is, as a healthcare scientist, it's a professionally recognised career. So like doctors and nurses, you're working to a set of standards which is recognised by professionals. And it just means that patients feel safer coming to you because you're qualified in that field. You've got the practical skills to help and support them. And although you're sort of behind the scenes to a certain degree, you are actually involved in around about 80% of all patient care decisions. So although doctors and nurses would be at the forefront with that patient and will be implementing the treatment and care that you are helping them decide on, it's you doing the number crunching and looking at their data and results to try and help with whichever pathway they go down. So there are around about 50 different types of healthcare science fields. So really, depending on which field of biology you're interested in, you've got a huge wealth and broad set of different specialisms that you can go down. They're split into 4 different sections, as you can see here on the screen. You've got physiological science, which really looks at how the body works. You've got the physical sciences, which is more around the mathematical side of disease. life sciences, which is the laboratory, so taking blood samples or tissue samples and investigating what's normal versus abnormal. So that could be in hematology, or around COVID, for example, it could be microbiology. And then you've got bioinformatics, which is really looking at that technology side of things and identifying the different techniques that you might be able to use to help diagnose a disease using computers particularly. Now, ophthalmic imaging, which is where we're now going to start to focus, is one of the physiological sciences sections. So what would you study if you were to do the ophthalmic imaging degree? So as I mentioned, I'm currently setting that degree up at the University of Gloucestershire. It's a 3-year degree, and we're currently the only university in the country that delivers that course. It's delivered through distance learning. And during the whole 3 years, you will have not only the theory or the knowledge behind ophthalmic imaging, you will learn the practical skills that you need to work in clinic as well. And we very much work alongside the local hospital. As you can see on the screen here, these are pictures of both Cheltenham and Gloucester Royal in our local area. So during the 3-year degree, you will very much have a focus on the clinical skills that you need to learn. And we do that through clinical placements. So across the 3 years, you would have a minimum of 10 weeks clinical work in year 1, 15 weeks in year 2, and then you would move on and have a longer extended clinical placement in year 3, lasting up to at least 25 weeks. And this really gives you the true flavour of healthcare science. You'll be working with the equipment, you'll be working with patients and working along trained staff to help and support your training. But in the background, you'll also be getting the academic university training so that you can really sort of explore those skills in a safe environment using simulation. So here you can see one of our healthcare scientists who is just taking blood pressure measurements of this patient, which is actually a dummied patient, so that they can practice those skills. So when they then go into their clinical placement, you really feel confident and comfortable with doing that with a real life patient. In year 1, you particularly look at subjects which are related to sort of knowledge and theory of the underlying healthcare science topics. So you're looking at anatomy, you're looking at mathematics and science and technology, and you're looking at how the body works, really. So if we're looking from an ophthalmic imaging perspective, it's learning the function of the eye, looking at the nervous system, seeing how the structure works, and then potentially using that technology to take images of the back of the eye to see whether or not there's any abnormalities there. As you progress into year 2, it starts to focus a little bit more on analysing that information. So you'll be taking some of the results that you're getting from your patients and really trying to compare normal with abnormal so that you can then look at making those very important decisions around diagnostics, for example. Here is a particular image which you might be taking, and you'll need to be able to interpret, if you like, whether or not this is a normal image or whether or not this is something where you would need to put some interventions in for the patient. And I'll let Paul talk about that a little bit more as we go through. And then finally, as you move into year 3, it allows you to explore the topic a little bit more at your own pace. So you can look at a particular technique or a particular disease that you're interested in, and hone down into a research project to really get you to explore that element that you're fascinated about for that final year. Particularly that might be sort of artificial intelligence and technology related to how the eye functions, for example. And I will now pass over to Paul, who's going to go through ophthalmic imaging in a little bit more detail.
Okay, so thanks, Tracy. So I'm Paul. I'm an ophthalmic imager for Gloucester Hospitals, and I've been working in that role for 7 years. The last 4 of those, I've also been an assessor on a related course run by our education team here, which is linked with the University of Gloucestershire. I'm here to talk a bit about why you should consider the ophthalmic imaging career pathway of healthcare science. So ophthalmic imaging, it is a very varied and progressive sector with ongoing research and developments in technology and software. This is out to improve the imaging techniques that are available. This makes it a growing and a very exciting industry to be involved in. And ophthalmic imagers are fundamental to the smooth running of ophthalmology departments. Traditionally, as the role has developed, ophthalmic imagers have come from a variety of backgrounds, such as photography, nursing, diabetic eye screening, and optometry. Their knowledge and their skills have been learned on the job and through experience, as opportunities for formal sort of specific training has so far not really been available. Typically, as an ophthalmic imager, you're part of a multidisciplinary team, and your role is to complete diagnostic tests on patients presenting with a variety of eye conditions. You are supporting the clinical decision-making of patients by providing those images and the reports that come with those images as well. And this is for the optometrists and the consultants in the wider ophthalmology teams. This is what makes it exciting, and every day is different when you are an ophthalmic imager as well. So you will practice a comprehensive ophthalmic service, and the healthcare science degree will introduce you to all of these. One of the most intensely used is optical coherence tomography, or better known as OCT, which is a high-resolution 3D imaging technique used in the assessment of lots of different ophthalmic conditions. And as you can see here, the patient is positioned at the camera, and the imager will line up the lens to look through the pupil of the back of the eye to the back of the eye. So they're adjusting the focus, the distance, and the exposure to find the sweet spot. And in the middle, as Tracy was mentioning earlier, the normal and the abnormal. So we've got an example of a normal and a form of abnormal OCT. The abnormal can show a variety of different changes. It depends on the condition. The one we have here is demonstrating some inflammation and some retinal thickening caused by an ophthalmic condition. On the right, we have an illustration of retinal layers seen overlying a normal OCT. Each of these individual layers has a purpose to help you see, and they are formed with varying cell structures as well. So it's important to gather the details correctly as an imager when capturing those OCTs. Next here, we have some fundus photography examples. So this is another form of retinal imaging at the back of the eye. It'd be similar to an OCT, but you are demonstrating a 2D image rather than the 3D scan of an OCT. It can be in color, in infrared, or in red-free, demonstrated by the image on the left. Different fundus cameras can operate different angles as well. So you could have a 30-degree camera looking closer at the macular area, the central area of the image, or you might have something up to 100 degrees or more. Demonstrated with the images on the right, you can see a much wider, a really wide field, and you're looking right out to the edges, or what we call the periphery of the retina. This image on the right is demonstrating a patient who has had an occlusion or a blocking of a vessel, and there has been some leakage. This could also be monitored with an OCT as well. So here is one of my personal favorites. This is an example of images of a patient who's had a form of dye enter into their bloodstream. And within the eye, the imager can observe blood flow and monitor any abnormalities such as leaking blood vessels. This is called a fundus fluorescein angiography, or FFA for short. In the image on the left, we're looking at a relatively normal 30-degree FFA image, showing a fairly even flow of white fluorescing vessels around the area shown. However, on the right, it's a wider view image, and we are seeing some damage at the back of the eye there, seen by the patches of the darker zones between the larger veins and arteries. Without these types of imaging techniques carried out by the ophthalmic imager, it would be much harder for the patients to be carefully monitored and adequately diagnosed. So it's also important to note that many diseases related to the back of the eye may not be noticeable to an individual until it is too late to completely reverse that damage. So the role of an ophthalmic imager, it is a vital one in identifying any changes in the eye. Good knowledge of eye anatomy, pathology, and the principles of the ophthalmic imaging techniques are required. When capturing images, the data, and the reports that are produced, they are important to calculate the treatment and management pathways for patients. So any errors in the images must be realized and corrected by the ophthalmic imager. And finally, really on this section, just when thinking about why to consider a career in ophthalmic imaging, well, if you're in a position of patient care, if you're interested in a position of patient care focus, good communication skills are essential, and you'll be at the forefront of a growing imaging industry in healthcare. So if that sounds like something for you, you might be a good fit for an ophthalmic imaging professional. And now we'll just hand back to Tracy to talk about some application tips.
Thanks, Paul. So hopefully now you've learned a little bit about healthcare science, and you've really now got a flavour of what ophthalmic imaging is about. So in terms of if you wanted to then apply for this degree, most of the application hints and tips are reasonable. So, you know, you'd want to make sure that your application is professional. You'd want to make sure that your grammar and spelling is appropriate, because it's that attention to detail that we were looking for somebody who becomes a healthcare science, because it's really important that you have that attention to detail in any analysis that you're doing with regards to any patient data. Now, for me, if I was looking at an application for any students who are willing to come on the course, there were a few elements that I would particularly be looking for. I would want to see that you were passionate in science itself. So maybe you could talk about what you've learned during your A-levels or through your BTEC qualifications, for example, just to get that passion across. It may be that you've had some work experience in a scientific field. So getting that approach across as well in your application would be really useful. If you're technically minded, so you're really inquisitive and you like problem solving, then that's a really good area as well for you to get across in your personal statement. Maybe talk about some of the research or investigations that you've done during your previous qualifications, just to sort of highlight what you liked about them and what you found were really beneficial. And then finally, really, really important, if you want to be a healthcare scientist, not only are you going to need to have that science and that technology mind, you're also going to need to have a really, really good caring and passionate approach to people. So perhaps talking through patient care or experiences that you've had with customer service, particularly if it hasn't been patient related, will really show how you treat people and the behaviours that you like and the values that you think about when you're working with different people. And I'm going to pass over to Paul, who will then talk us through a few pieces around the careers in ophthalmic imaging specifically, and then finally how you can apply to ourselves.
Thanks, Tracy. So the career pathway for an ophthalmic imager typically starts at trainee level, that's band 4, and there are opportunities for career progression in the field up to a band 6 or even a band 7. There has been a significant increase in the number of patients requiring assessment via the ophthalmic imaging services over the last decade. And in the last 7 years, I've seen this firsthand. The population is living longer and disease prevention and management is improving through research and trials. Whilst the numbers being seen in clinics have increased, the types of imaging equipment and processes required to image have improved too, which helps keep up with the demand. More powerful imaging techniques and diagnostic technology has allowed ophthalmic imagers and technicians to regularly improve their own knowledge and skill sets. Some imaging services have begun to operate in a virtual capacity, meaning more patients can be seen and assessed in any one session. This proves that the industry has the ability to move forward with the available technology and software around at the time. many of the imaging techniques are non-invasive as well, so it is safer for patients. The value of a qualified ophthalmic imager is increasing, and this will be even more so in the coming years, with lots of opportunities for growth and progression. As an ophthalmic imager, you have the responsibility of completing accurate images and saving true data that is medically valuable. And this is supporting the multidisciplinary team in the assessment and pathway of patients. So just to finish off, if being involved in a growing technology-led industry with patient care at its heart sounds like an exciting career path for you, then I encourage you to get in contact. The details are on the screen. You can ask us any questions you may have, and we'd look forward to hearing from you. Thank you for listening.